Metabolic syndrome is a cluster of conditions that occur together, increasing your risk of heart disease, stroke, and type 2 diabetes. These conditions include increased blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol or triglyceride levels. How do you fix metabolic syndrome? Heart-healthy lifestyle changes are the first line of treatment for metabolic syndrome. You may have to see a dietitian and a physical therapist to help find a diet and exercise plan that works for you. If healthy lifestyle changes do not work, you may need medicines or weight loss surgery. Which is one of the signs of the metabolic syndrome? How is metabolic syndrome diagnosed? A large waistline, which means a waist measurement of a high triglyceride level, which is 150 mg/dl or higher. A low HDL cholesterol level, which is high blood pressure, which is a reading of 130/85 of a millimeter of mercury or higher. A high fasting blood sugar, which is 100 mg/dl or higher. What are the three components of metabolic syndrome? A person is diagnosed as having metabolic syndrome when they have any three or more of central, abdominal, obesity, excess fat in and around the stomach, abdomen, raised blood pressure, hypertension, high blood triglycerides. What triggers metabolic syndrome? Metabolic syndrome is closely linked to overweight or obesity and inactivity. It's also linked to a condition called insulin resistance. Normally, your digestive system breaks down the foods you eat into sugar. Insulin is a hormone made by your pancreas that helps sugar enter your cells to be used as fuel. What is the root cause of metabolic syndrome? Underlying causes of metabolic syndrome include overweight and obesity, insulin resistance, physical inactivity, genetic factors, and increasing age. How do you test for metabolic syndrome? To diagnose metabolic syndrome, your provider will check your blood pressure and do blood tests to measure your blood sugar, cholesterol, and triglyceride levels. Does metabolic syndrome go away? If your doctor diagnoses you with metabolic syndrome, it's important to take action. Through lifestyle changes and medications, metabolic syndrome may be able to be reversed, reducing your risk of developing a more serious health condition. What vitamins are good for metabolic syndrome? You may benefit from the following supplements: for blood sugar, chromium supplements. For cholesterol, psyllium fiber, niacin or vitamin B3 complex supplements, omega-3 fatty acid supplements. For blood pressure, potassium supplements. What age does metabolic syndrome start? The prevalence of IDF-defined metabolic syndrome increased from 11.0% in the 20 to 29 years age group to 47.2% in the 80 to 89 years group in men, and from 9.2% to 64.4% for women in the corresponding age groups. Which patient is at highest risk for developing metabolic syndrome? The number of people with metabolic syndrome increases with age, affecting more than 40% of people in their 60s and 70s. What organs are affected by metabolic syndrome? Pathology in various tissues is common in individuals with metabolic syndrome. Key targets for damage include the cardiovascular system, pancreas, and liver. What medication is linked to metabolic syndrome? Clozapine and olanzapine are associated with the greatest weight gain, followed by risperidone and quetiapine. Ziprasidone and aripiprazole are associated with the least amount of weight gain. The mechanisms by which antipsychotic medications induce weight gain and metabolic alterations are unknown. Does stress cause metabolic syndrome? The metabolic syndrome is thought to be multifactorial in origin, arising from a combination of genetic and environmental factors. Among the plausible environmental factors is psychosocial stress. However, research on the importance of stress and the etiology of the metabolic syndrome is scanty. Does metabolic syndrome mean diabetes? Metabolic syndrome is a group of conditions that together raise your risk of coronary heart disease, diabetes, stroke, and other serious health problems. Metabolic syndrome is also called insulin resistance syndrome. How do you fix metabolic syndrome naturally? Lifestyle and home remedies. 1. Regular physical activity. 1. Health experts recommend getting at least 30 minutes of exercise, such as brisk walking, daily. 2. Weight loss. 3. Healthy diet. 4. Stopping smoking. 5. Reducing or managing stress. How long does it take to repair a damaged metabolism? Basically, anything that lowers stress hormones and restores balance to your neuroendocrine system will aid your recovery. Expect to be back on track within 1 to 3 months. Are metabolic disorders serious? It puts you at greater risk of getting coronary heart disease, stroke, and other conditions that affect the blood vessels. On their own, diabetes, high blood pressure, and obesity can damage your blood vessels, but having all three together is particularly dangerous. Does walking help metabolic syndrome? Whether you walk, bike, dance, run, or lift weights, you are likely to be reducing your risk of metabolic syndrome. How can you lose weight if you have metabolic syndrome? If you don't prod the insulin, your body will use the fat you have. She advises eating lean protein, nuts, vegetables, and low-carb fruits such as berries and melon. Once you reach your desired weight, switching to a Mediterranean diet will help you maintain a healthy weight. How much exercise is needed for metabolic syndrome? However, when prescribing exercise for someone with metabolic syndrome, fitness professionals are encouraged to recommend 30 to 60 minutes of daily moderate intensity aerobic/endurance type PA and at least 2 days per week of RT. Which of the foods should be taken by metabolic syndrome patient? The best foods to eat on a metabolic syndrome diet are vegetables, healthy fats, and whole grains. People with metabolic syndrome should avoid foods high in sugar, simple carbohydrates, and sodium. What is the difference between diabetes and metabolic syndrome? Metabolic syndrome includes symptoms of prediabetes but covers a broader cluster of conditions. People with metabolic syndrome may have increased blood pressure, high blood sugar, excess fat around the waist, high cholesterol, and triglyceride levels. Does metabolic syndrome cause weight gain? If you gain weight around your waist, it can be one indicator of metabolic syndrome. But some of the other diseases that go along with metabolic syndrome do have symptoms. These include possible frequent urination and unusual thirst when you have diabetes.